Hello, hi, namaste. Welcome to our the Healing Prana podcast. We have with us today Harini Vasan. She's our diet and nutrition coach. Hello, Harini. Welcome to the podcast.
Thank you so much, Rashid.
Okay.
Uh,
Let's jump into the. Sorry, go ahead, please. You were saying something. Go ahead.
no, you please continue. Continue with that. Continue with it. There's
Okay.
no problem.
Thank you, Harini, for joining the podcast. Today's podcast.
My
Um,
pleasure. My pleasure.
There is a burning question which a lot of people want to hear about the
hmm
PCOS and PCOD. Can you please
hmm
help us understand what is it all about?
Yeah. So actually, this question is very important in this scenario, I guess, because most of the patients I handle, they can't even differentiate whether they have PCOS or PCOD. Most of the doctors don't give clarity to any of the patients like what is the root cause of their disorders or the disease. So most of the time patients also not paying that attention to distinguish the difference between PCOD and PCOS. So there are two prime distinct difference. Like PCOD is more of a broader spectrum, and PCOS is like with genetically inducing factors, relied on. So, as you know, like polycystic ovarian disease, there could be two difference. It could be a disease or it could be a syndrome. So, if it is PCOS, it's a syndrome. If it is a PCOD, it is a disease. So, what distinguish the disease and the syndrome? Syndrome is something that metabolically, if your health is not at your best, then we call it as PCOD. If it is a disease, which means it has some physiological dysfunction present in it. So this is the two different difference between PCOD and PCOS. What is the physical characteristic that distinguish from PCOD and PCOS is PCOD is more of like in your ovaries, like there will be a lot of eggs produced, right? If your ovaries produce immature eggs, and that leads to producing cysts in the ovaries. We call it as PCOS, sorry, PCOD. So if it is PCOS, it's more of hormonal imbalance. Like your
Mhm.
body will be high with testosterone and
Mhm.
androgen. So we call it as hyperandrogenism. So that's when people tend to have a lot of facial hair. They tend to have a lot of
Okay.
like acne. They do have a lot of like pimples in the face, and they do have like a beard. Like that these symptoms collectively we call hirsutism. So these are prime symptoms of PCOS. So I believe these are the two prime symptoms that distinguish PCOS and PCOD. So anybody who is getting diagnosed with this, ask your gynecologist whether I have PCOS or PCOD. Most of the time they fail to ask this, and even doctors are not, you know, caring to, help the patient to understand actually they are going through. So, so in a way, but as I was saying, both the condition can be easily sustainably cured with proper food lifestyle changes. So most of the times doctor would say like there is no solution for it. We have to go through it lifelong. So it's not the case at all. Any health changes that you want to bring about in your body needs like just 90 days. If you're committed and if you're willing to put that effort to to give your best in terms of changing your lifestyle, for sure within 90 days, any syndrome, it could be any syndrome or disease, it could be, you can have all the possibilities to reverse it. Yes. Hope I have given justice to the question, I guess.
Wow. Um, that was really eye-opening information, Harini. The lot of details were given there. PCOS and PCOD. I know you're the best person to explain, and hopefully we have got all the information there. Now, when you're talking about the food, you said that you can manage these syndrome or the disease. That's really good. And what sort of food a person who is having this should have, and what should be avoided?
So, I already in the last podcast we spoke about lactose intolerance, right? So there are certain food constituents that could trigger metabolic syndrome. So metabolic syndromes are collectively we are calling it as metabolic syndromes. So diabetes is a metabolic syndrome. Hypertension is a metabolic syndrome. PCOD is a metabolic syndrome. Like high cholesterol level is a metabolic syndrome. So metabolic syndrome is something that you had acquired because of your bad lifestyle. It's not something genetical. So in a way, if you can bring that unhealthy, unfunctional, values to your body, you have the possibility to reverse it, right? That's the cause. So if you can bring about the unhealthiness to your body, for sure it could be reversed, right, with the proper diet and nutrition. So most of the times, doctor give that illusion that any syndrome cannot be cured 100% because doctor cannot help the patient to go like have a proper lifestyle. They cannot help them because they do have their standard protocols where they just try to give prescription just like an immediate solution. They cannot help the patient to have like a transformation. Is that the word that we can use it here? So doctor can give like immediate solution or a painkiller or something just to help the patient to suppress the symptoms, but only a health coach or a nutritionist or a holistic wellness coach would help the patient to help them to like get through the disease until they reverse it. So as I was saying, there are certain foods that we have to completely avoid. Gluten especially, which is very very important in making all these dysfunctions in the body. So gluten is something we cannot give the PCOD or PCOS patient. And you can take lactose. Lactose is something which is not good for diabetic as well as PCOS patient because I feel lactose is something is spiking the sugar levels, like the insulin levels. So in a way, if anything that increase the insulin level, that tend to create a lot of metabolical symptoms. It could be, as I was saying, we were discussing about facial hairs, or we were discussing about obesity. So these are caused by lactose. So in a way, lactose, gluten, and sugars for sure are prime, ingredients that we have to neglect from our diet. So it's not that easy, right? Most of our Indian meal, or it could be any meal could be, it should have it is having some amount of gluten in it, right? So we have to choose the ingredient that would work best for the patient, as well as we have to give the replacement. If I'm removing something, I have to give the best replacement to have, right? I cannot just ask them to eliminate everything from the diet. So we will be giving like very nutritious, nutrient dense, protein rich replacements to go with. That in turn will help the patients to reverse the condition. Yes,
Wow. Again, so much of information, Arani. I know we can go on talking about it. You have you've given me so much of information. Now, you talked about lactose, gluten, and sugar. So these three are the main culprits. Now, what if someone loses the weight? Do you think keeping all three into consideration of these things, limiting their intake, can they reverse PCOS or PCOD?
absolutely. As I was saying, you can change your lifestyle for sure. If you are willing to change the lifestyle for sure, any disease condition can be easily suppressed. So Again, for example, if you are putting the effort in 90 days, you are being strict, and that should be a factor that should be sustainable. If any lifestyle change that you are bringing about in your life, if it is very extreme in a way that you are able to follow for a very short span of time, like month or so, it is not going to continue lifelong, right? Any lifestyle changes, you should, if you are picking a habit even, you should see like whether like I can do this every day of my life. If it is yes, then you can choose it. Even if it is a eating habit, eating pattern, or it could be any lifestyle changes, exercise, anything. Ask yourself, will I able to do this lifelong? If it is yes, you can continue with that. As I said, all three ingredients are very important. As I was saying, as a Indian in an Indian household, sugar plays a very vital role. We add sugars in everything, and we add rice in everything. Most of the people will say rice doesn't have gluten in it, but it does has uh, certain type of gluten which people fail to understand. And talking about wheat, we usually have, if it is North Indian, they do have wheat as a staple food, right? They do consider like they cannot live without like roti. So in a way, roti is also kind of high in gluten in a way that we cannot encourage the patient. But you can go for like alternatives. There are very rich alternatives, as India is known for its agriculture. There are very native indigenous cereals that we have. Those can help them in a way to reverse the condition. So people popularly talk about quinoas, right? Which comes from like from the West. So anything that comes from the West, people try to pick it up, thinking that it's healthy, right? We have
Mhm.
like equal number of indigenous millet, like around 20 to 25 these types of millets. Like nobody even knows the name. Like hardly people know like foxtail, barnyard. Other than that, they doesn't know any of the other millets. There could be, you know, uh, you know, ways where we can help the patient to incorporate all these millets in their lifestyle, so that as a sustainable change, if they are bringing about in their lifestyle, that could help them to reverse the condition. So as I was saying, you should not have any blockage in your mind before having any form of transformation. You should not say like I only have I will take only response coming from the West. I don't believe in something that's rooted in our culture. So in a way, we have to believe what we have, what we are given with, and we have to choose the best with the option that we are given with, instead of looking for out. So I think having said that, all these options that I have told you would help them in a way to reverse the condition very easily.
Wow. Thank you. You said it right, Harni. Whatever is indigenously grown and easily available in our local grown food is what is actually should we need to have that rather than having the exotic foods getting from foreign countries. There's a saying that if we eat what our forefathers have eaten, we would be healthy, simple, rather than trying different sort of things which trying to adjust to the West. Very well said. Very good point to bring it up. Um, Also, why the working professionals or nowadays the youngsters are having this PCOS or PCOD issues? What do you think? What would be that? Is it the working lifestyle, as you said earlier, or is it could be the diet and the nutrition where the foods which we have grown is not having that enough power? Or what do you think? Because a lot of people who are working, and it could be housewives, this generation especially, they're facing a lot of issues related to the fertility. What do you think about it?
Yeah. So I think uh, talking about modern women of this generation, they doesn't have any mobility. So mobility is the key for health. Most of the time, they even with a desk job, and they spend most of their time in their office, and they hardly move from their seat. So that could be one of the major contributing factor for PCOD or PCOS, because there is no movement at all. and they do have helpers at home to do the household work and take care of things at home. So even at home, they don't have any strenuous activity to consider as a physical activity. So in a way, both the thing and contributing factor is they tend to eat more than they need. So like why I'm saying like more than they need, because people are like not understanding the fact that your brain consumes 80% of your food and like your body consumes only 20% of the food. So because of the stress, work pressure, it could be, or it could be any personal traumas that they are going through. If they are going through those things that make them hop on food every hour, so they tend to drink a lot of coffee, they tend to drink a lot of teas, milk, or any kind of caffeine it could be, and they hop on a lot of junk. They hop on a lot of heavy calorie meal uh, without having any idea about what this food is going to you know impact their health. So I think as a modern woman, I believe we don't need free meal at all for the kind of lifestyle and the physical activity we have. We don't need free meal, and we don't need sugars at all. Sugars like are like luxury. We should think like it's a luxury. Only if you are doing like at least 2 hours of physically active lifestyle, then you can have some form of sugar, like a luxury. So if your physical activity is not in its place, then I don't think you should consider sugar as a dietary routine in your life at all. So it's not going to work for you. So in a way, your lifestyle uh, will play a lot of role in terms of reversing this condition, as well how you are maintaining your mental health and how your energies are aligned. I think you could be the best person to talk about that because you're dealing with people condition through yoga. You're dealing so in a way, energy plays a lot of role in terms of placing their mental health, keeping their mental health in place. So I think yoga can help them in a way to keep their body and energies calm. So in a way, they can reduce the amount of food that they are consuming and the cravings that they are getting experiencing throughout the day can be easily suppressed. Having said that, both diet and mental health plays a very, very, very important role in terms of bringing that transformation in the patient so that they feel that wellness. It's not just about suppressing the symptoms or reversing the condition. They should feel best with their health. So if that has to happen, like we should take it like a holistic approach. So uh, diet, wellness, I mean mental wellness, and energy and alignment. So all these things plays a very, very big role in terms of transformation, I guess.
Wow, amazingly put, Harni. Wonderful. So people are moving less, and there is not much movement because of the lifestyle, and they're emotionally eating. When they are stressed, they are eating. Even the body is not required the food, they are still eating. Very well put. All this information. One last question is, what would you say to other viewers who are watching this? Why diet is very important in the current trend, or why they need to join our workshop, which we are doing, the 3D detox program. You would be there, Deepti would be there, and myself. What is one suggestion or something that you would try to push forward?
So, for example, if you have any metabolic syndrome, diabetes, hypertension, or thyroid, PCOD, so your age would be anywhere between 20 to 30. This is the age group that they belong to most of the times. So already you're 30 years gone, right? So the expectation is going to be like maybe we will live till 60 or 70. So you have just 30 years ahead to live a healthy life. You have already wasted the first 30 years of your life. Uh, you know, thinking yourself you're depressed, you're stressed. You have like a lot of other reasons to acquire all these. At least you take that leap of faith in transforming yourself, spending the rest of your life without medication. If you think your body and mind is worth giving that attention, you will do it. If you think this life is just to have fun, and if you think my life is like just to, eat whatever I like and whichever way I want to live, that's up to you. But if you really think your life is worth paying attention for, then for sure you have to, hop into our workshop where we will be talking about what actually mental health is and what actually diet and nutrition is and what actually energy alignment is. So I think these three, factors will be covered, and I think this is the reason that you should consider. Other than that, any other reason you have to consider? No, you have just 30 years, to lead ahead. So if you think you want to lead a life which is stressful, depressed with medication or not, that's the question.
Wow. Wow. So you covered all the bases. Thanks so much, Harni. We three are starting the podcast. We have already started, and we are into the detox program now. So I would say whoever is joining is going to take a lot of valuable information from you, Deepthi, and me. It's amazing. These are we are the three pillars. We're focusing on diet, nutrition, energy healing, and yoga meditation. Thanks a lot for joining today, Harini.
Thank you
Wonderful
so much
information
for
you have given us. It was so
thank you for
insightful.
all the questions, insightful questions. Thank
Thanks
you.
a lot. Thanks a lot. We join again. Thank you so much.
Thank you so much, Shashi. Bye bye.